I'm Victoria Blackhorse. I am an internal medicine doctor at University Village. As an internal medicine doctor, since the training itself is quite vast, we end up treating heart failure, diabetes, women's health, mental health, for instance, like anxiety, depression, a lot of musculoskeletal conditions as well, such as like osteoarthritis or back pain. I think it is a hopeful time in medicine right now. If you think about it, there's a lot of new literature coming out, a lot of new medications, and I think with the development of technology and that expansion, healthcare within itself ends up expanding with technology. I love working at a clinic, especially when it feels like a tight-knit family taking care of our patients. I also love being able to make a difference in somebody's life, whether that's taking a moment to listen to a patient or basically being able to help a patient achieve one of their goals that they set for themselves. I think that ends up making my day. I think it's really rewarding when you're able to work with a patient and achieve an outcome that they had wanted or some type of goal. It's definitely very satisfying. I'm inspired by my patients quite frequently, just thinking about them as a human being, as an individual, and what else is going on in their life, whether that's dealing with sick family members, financial situations, other type of stressors, but they're able to take time aside for themselves and focus on their health so that they're able to be kind of a strong person for other individuals as well. The way that I keep a patient at the top of the pyramid is focusing on the patient-doctor relationship, but more importantly, the listening and communication aspect. Interestingly enough, all throughout training, it's really been emphasized to listen to the patient because the answer is actually in the history that they end up providing. I also like to communicate with my patients, especially thinking about how overwhelming the healthcare system can be to navigate, and specifically like in the clinic visit, being able to go through what's going kind of on in my mind with what I'm thinking about, what's going on with them, in addition to what further workup we're going to do or the future plan, and specifically being able to write that out for them as well so that they can look back later and kind of be reminded. I make each patient feel unique by focusing on them more as a human being, as an individual, and who is sitting there right in front of me. I think the team approach definitely benefits the patient, especially in a primary care office where you have a lot of different types of individuals with one goal of taking care of that patient, whether that's the front desk individuals, medical assistants, nurse practitioners, doctors, just all focusing on how to take care of the patient and how to help their health. Having grown up in the area, Virginia Mason has definitely been a large institution in the Seattle area, and I specifically wanted to work at Virginia Mason because of their patient approach of keeping the patient at the top of the pyramid, but also focusing on efficiency and eliminating waste. I think the doctor-patient relationship is really important and also sometimes understated. If you think about it, that person is coming to you really vulnerable, and there's actually an innate trust that is given to you. And so definitely respecting that relationship is important. Being raised in the area, I definitely appreciate the outdoor scene as well as coffee. I am getting into cooking, baking. I end up doing some artwork on the side, but also being a member of the Seminole Nation of Oklahoma, I like to find time to do some Native youth mentorship.